This is Mike. When Mike came to me, I said, on a scale of 0 to 10, how is your pain level? And he said, it's a 12. So he has a very high tolerance to pain. He has hip arthritis, very severe hip arthritis. The doctor wanted to give him, they did give you injections, drugs, all that, right? And it helped for a little bit, and then it was back up to a 12 out of 10, right? So go ahead and stand up, Mike. Would you mind? And then go ahead and squat down. And at what point does it start to hurt in that hip?
Yeah, right about here.
And then where does it hurt? Point to me with your fingertips.
Yeah, up front.
Right there?
Up in the front, right.
Okay.
Right here.
Right up in there? Okay, so go ahead and lay down on your back. So what I'm going to do with Mike is I'm going to release his hip, okay? So does this hurt at all, Mike?
Not yet. Yeah, right there.
So when I first met him, he was like that. He had about 5 degrees of rotation. So we've worked on a few things, and now he's pretty much got full range of motion, just hurts at end range. So let's see here. So point to me where it hurts the most.
Yeah.
Right in there?
Right in here.
So using my treatment method, I'm going to stimulate, there's over 40 different areas of the body that I can use, but I am going to stimulate just, this one's right in front of my face, so that connects to his hip. Now, you can't just press exactly where I'm pressing because it matters with joint angles and angles of pressure. So like this right here connects to here, right? But if he brings his leg out like this, brings it out like 5 degrees, then it doesn't connect here anymore. Now it connects over here. And if he goes like this and I didn't move my finger, it doesn't connect here anymore. It'll connect way over in here. If I change my angle of pressure, then like right here connects right here. But if I went like this, then it would connect up here. And if I went like that and changed my angle, now it connects down here. If he straightened his leg and changed the fascial suit, right? Here doesn't connect here anymore, now it connects down here. So it's actually very precise, and I've mapped the body so that anybody can do it. So what I do when somebody comes in with pretty severe hip arthritis, I release the whole hip. So this will just release the joint, and I just kind of release the whole hip. I use this to kind of save my hands. But Mike actually golfed. So when I first met him, he said he had a 12 out of 10 pain, right? And he said, I read on your website or something that you said that your patients are in pain for 3 visits. And sure enough, 3 visits later, your pain was pretty much like a 1 or a 2, right?
Right.
And I said, Mike, there's 2 ways of doing this. You can take a drug, or you can get an injection to decrease the inflammation, or you can change your diet, and that'll decrease the inflammation too. I will tell you, not a lot of people are too fond of that idea, but Mike did it, and he changed his diet, and when he did, he was at a 0 out of 10 pain, right?
That's right.
And now today is actually a very cold day in Florida, believe it or not. It's 40s and 50s, so he's contributing that to this little flare up here. So let's see if this made any difference. So his range, so it looks like he's got better range there. Does that hurt at all?
No, what I feel is it now moved.
Okay.
It's moved to the inside.
So if you notice, he pointed to pain was here, but it's not there anymore. So there's no pain here, but he says it's more in the groin area. So I got to readjust and hit that area. Go ahead and point to me where that pain was. More in the groin. So what I'm going to do is I'm going to stimulate it here. But he looked like he had better range of motion there. I could have measured it, but that would take a little time there. So I like instant results. I'm willing to do whatever it takes, you know. I don't like to sit and have to wait 3 weeks for my patient to start feeling better. So what I do is try to find connections. Let's see if I got it. I think it might be referred pain, but what about now?
Yeah, that's better.
Better? Any pain?
Yeah, no.
No? right, so if you look, his range of motion is much, much better. So it looks like about full range of motion now, so go ahead and stand up and squat down.
All right, that's a lot better. I mean, what was a 2 or 3 is probably about a 1 down there.
And point to me where it is.
Yeah, again, now, when I got down that time, I could feel that still up front.
Up front there.
Yeah.
So it's about a 1 out of 10 pain now, you said, right?
Right.
So let's see here. Let me turn your hand over this way. So I'm just going to treat him standing up. So let me try to do the bicep here. Now again, this bicep tendon, I could try to hit his bicep that connects to his hip, but if he turns if he pronated like 5 degrees, then this wouldn't even connect in his hip anymore. It would connect like way over here on his lateral. It wouldn't connect to the anterior hip, it would connect to the lateral hip. So these are very precise points. It's not just push here. Now go ahead and do it again. We'll see if that changed anything. Much lower.
Yeah. No, that's good.
That's better?
I could feel the difference.
Yeah.
Yeah,
So he's got full range of motion. He's able to go all the way down now. So what I'm going to do with him is I'll do another method that I invented. I have not given it a name yet. I would tell you the name, but I don't know the name. And then I do lasers on him. I do scalar devices. I do electricity on acupuncture points. So that's what we'll do.